Hi, in this video we are going to look at the vitamin D, which is a fat-soluble vitamin. Sources of vitamin D is food and sunlight. In food such as salmon is a good source of vitamin D, and dairy products like milk and yogurt, cheese, and egg yolk is a good source of vitamin D. Some plants contain ergosterol, and which is converted into vitamin D. So skin exposure to the sunlight, let's imagine here is the sun and here is the sunlight and here is the skin. In our skin there is a chemical form or precursor of vitamin D is 7-dehydrocholesterol, which is converted into cholecalciferol. Now 7-dehydrocholesterol from the skin and ergosterol from the plants is converted in our body into cholecalciferol and ergocalciferol, which is then taken to the liver, and where there is an enzyme in the liver called 25-hydroxylase enzyme, which converts cholecalciferol and ergocalciferol into 25-hydroxycholecalciferol. And then 25-hydroxycholecalciferol is converted in the kidney by another enzyme called 1-alpha-hydroxylase into 1,25-dihydroxycholecalciferol. Now, this enzyme is activated by parathyroid hormone. The drop in the serum calcium level is sensed by the parathyroid gland, which releases parathyroid hormone and activates this enzyme, and then converts 25-hydroxycholecalciferol into 1,25-dihydroxycholecalciferol, which is the active form of vitamin D. Now, vitamin D is also converted in other tissues like colon and prostate and immune cells in a small amount. Function of vitamin D is it decreases the risk of multiple sclerosis, which is autoimmune disease. It decreases the development of the heart disease. It also decreases the risk of development of the flu, decreases the depression, and boosts the weight loss by suppressing the appetite. The important function, it absorbs the calcium and phosphate. Here is the cell from, let's say, small intestine, the enterocyte. And when the vitamin D enters the enterocyte, it increases the translation and transcription of different protein, which leads to increase of receptors. Now, here is the receptor called epithelial calcium receptor here. And then here is another receptor called the plasma membrane calcium ATPases. And this ATPase here. And then there is exchanger, which exchanges the calcium for sodium. So sodium calcium exchanger. Now, when the calcium enters the cell, it binds to a protein called binding. And the binding carries the calcium to the other side of the membrane. And from here, the calcium is absorbed through these receptors, right? And here it's exchanged for the sodium. So it also facilitates normal immune system. Now, how does it facilitate the immune system? In the respiratory infections like COVID-19, there is increased release and production of cytokines. The level of cytokine increases, which is called a cytokine storm. Now, the vitamin D believed to inhibit the production and release of cytokines. So it decreases the release and production of cytokines. That's how it inhibits the cytokine storm. And in one study found that the COVID-19 patients have higher level of serum viral load, which is closely correlated with the increased in interleukin 6, which is also cytokine, and vitamin D actually inhibits the release of interleukin 6. So vitamin D facilitates the antimicrobial peptides. These are like cathelicidins and defensins. Cathelicidins and defensins attack the pathogen's membrane and make it permeable. Let's say this is a virus or bacteria or a parasite, and they attack and make it permeable, which leads to a leak out of the content of the cell and the cell die. Cathelicidin and defensins are found on the immune cells and epithelial cells that are in contact with the environment. Now, what happens if you are having a deficiency of vitamin D? The signs and symptoms of deficiency of vitamin D are like tiredness, pain, and aches in the body. In children, it causes rickets, and in adults, it causes osteomalacia, which is the bone pain and muscle weakness, and hypocalcemia, tetany. This is all about the vitamin D.